Assalamualaikum, my name is SYAZWANA binti HASSAN. My metric number 071844 and I'm going to talk about pandemics and global health.
A pandemic is a disease outbreak that spreads across many countries, affecting a large number of people, while global health refers to health issues that cross national borders and require international cooperation. This topic is important because recent pandemics like COVID-19 and monkeypox have shown how quickly diseases can spread and disrupt lives worldwide, impacting health systems, economy, and daily routines. Understanding pandemics and global health help us prepare for future crises by learning from past experience. In this presentation, we will explore the key features of pandemics, examining a real-life case study, understanding their impacts, look how the world has responded, and discuss the challenges faced in managing global health threats.
Pandemics have several defining principles that show how far-reaching and serious their effects can be. One key feature is their rapid spread across borders, where diseases can move swiftly from one country to another and infect large populations within weeks. This quick transmission overwhelms health systems, especially when the disease poses a high risk to health and life, often resulting in high infection death rates. As a result, pandemic caused widespread disruption not just to healthcare but also the economies, education, travel, and also everyday life. Businesses close, schools shift online, and entire communities may face lockdowns. So, to manage such a large-scale crisis, global collaboration becomes essential. Countries must work together by sharing information, resources, and strategies through international organizations like the World Health Organization. However, the impact of pandemics is not equal for all. Vulnerable groups such as low-income communities, the elderly, and people with limited access to healthcare often suffer the most, facing greater risks and fewer resources to protect themselves.
A strong example of a pandemic is COVID-19, which was first detected in Wuhan, China in December 2019 and quickly spread across the globe by early 2020. It became one of the most severe health crises in modern history. Governments and international organizations, including the World Health Organization (WHO), responded with emergency measures such as lockdowns, travel restrictions, mass testing, and eventually rapid vaccine development and distribution. The pandemic had a massive impact on healthcare system that many hospitals were overwhelmed and medical resources became scarce. By mid-2022, over 600 million confirmed cases and more than 6 million deaths have been reported worldwide. Vaccination campaigns help reduce the severity and spread, with billions of doses administered globally. Data charts, maps, and graphs are useful here to show how fast the virus spread and how countries responded over time.
Pandemics have wide-ranging consequences that affect nearly every aspect of society. From a health perspective, they often lead to overcrowded hospitals, a shortage of medical supplies, and long-term health effects for many patients even after recovery. The economic impact is also severe, with widespread job losses, business closures, and in many cases, a global recession. On a social level, pandemic disrupt daily routines such as schools and universities are forced to close or move online. Mental health problems increase due to isolation and uncertainty, and strict travel restriction limits personal movement and global mobility. Politically, governments often invoke emergency powers to manage the crisis, which can lead to debates over civil liberties, privacy, and the balance between public safety and personal freedom. In some cases, there are even environmental effects such as temporary improvement in the air quality and reduced emissions during lockdown. In response to pandemics, both international and national efforts are crucial to control the spread and minimize the damage. At the international level, organizations like the World Health Organization provide guidelines, coordinate global responses, and support initiatives like COVAX, which aims to ensure fair access to vaccine worldwide. There are also vaccine diplomacy, where countries share or donate vaccines to strengthen global cooperation. On the national level, governments have implemented measures such as lockdowns, contact tracing, and mass vaccination campaigns to protect public health. However, these efforts often face significant challenges. One major issue is inequitable vaccine access, especially in low-income countries that lack the resources to secure enough doses.
In conclusion, pandemics are serious global threats that require fast, coordinated responses from countries around the world. They highlight the importance of strong healthcare system, early detection, and international cooperation to protect lives and reduce damage. As we have seen in COVID-19, no country is truly safe unless all countries are prepared. A pandemic anywhere is a threat everywhere, which is why continued investment in global health infrastructure, medical research, and education is essential to ensure a healthier, more resilient future for all.